Hi, my name is Isaac Ramirez, and I'm a psychiatrist who specializes in dealing and treating bipolar disorders. I have my own practice located in Lewisville, Texas, where I see a variety of patients, with most of them being in the age range of 15 to 45 years old. In my practice, I work with patients who deal with bipolar disorders, or also known as mania depression. Bipolar disorders are fairly common, affecting more than 12.3 million people in the US alone. Typically, I see one person out of 30 cases to have a bipolar disorder. The main symptoms are rapid mood swings, anger, anxiety, irritability, racing thoughts, depression, and rapid weight gain or rapid weight loss. As far as treatment, it depends from person to person, but most bipolar cases are treated with a mood stabilizing medication such as lithium carbonate or lithium valproic acid, along with cognitive behavioral therapy or counseling. With mood stabilizers, the effects occur right away, while counseling is more of a long term treatment to help the patient manage their routines and coping skills. Um, with one of my patients that I have seen in my clinic, she's a 25-year-old middle class Caucasian female experiencing hyperactivity, restlessness, and decreased focus. The patient had no previous medical issues with the disorder, but the patient's father did have a bipolar disorder, which is a risk factor. The patient was diagnosed by completing a mental health evaluation where I asked questions about symptoms, how long they have occurred, and how they affect the patient's daily life. After learning about her most recent episode, I had diagnosed my patient with mania bipolar disorder, and treatment for this patient included cognitive behavioral therapy, in which I helped the patient change the negative thoughts patterns into new coping skills. And also, the patient received a mobile stabilizing lithium medication. Although there is not a way to prevent bipolar disorders from occurring, it is important to be educated on this subject and know early warning signs and risk factors. If you or a loved one seems to be going through drastic mood swings or suffer from high levels of stress or even come from a background of drug and alcohol abuse, it is best to seek medical attention to see if you are suffering from a mental disorder. Most importantly, it is our job as health professionals to take the time to observe each case and make sure we are making the correct diagnosis. Unfortunately, in 2006, 69% of all cases were misdiagnosed, so that is one area where we simply have to get better and be more accurate.